Hi there, I'm Dr. Kelly Clarke, and today I'd like to talk about depression. Well, depression's not something most of us want to talk about, but I wanted to basically outline ideas around how do I know if I'm depressed? There's folks out there wondering if they're depressed and what features or factors would say that one's depressed. I know in the assessments I've done, there's often times where the person that I'm doing the assessment on is surprised they have depression. So I just wanted to talk a little bit more about depression and what that looks like. Probably many of you would realize that depression has multiple factors to it. There is a high disposition towards genetic factors contributing to depression. So that's not the only reason that a person might develop depression, because you could have actually genetic dispositions towards depression and actually never develop it. So the interaction with the environment is a big factor as well. So if you had, say, a disposition towards depressive features and you had just a really healthy home environment, very loving and safe family, very supportive and understanding, helped you move and manage emotions well, very accepting, that could really do well to keep depressive features from ever developing. Whereas the opposite is also true. So if you, say, didn't have strong indicators of depression genetically, and yet were raised in a very troubled home, uncaring, even abusive home, then that certainly can contribute to a person's self-worth, belief in themselves, and negative dispositions towards their future, which we'll get into a little bit more. What does depression look like for the person? So there's certainly factors of genetic factors, environment, lifestyle, or life events. Certainly when somebody, say, would have financial issues or adjustment problems or difficulties managing things in their life, or had a significant loss, these can bring on depressive features. So there's a whole host of things that can contribute to depression, including neurochemical reasons. So sometimes people are having an underproduction of, say, a neurochemical responsible or helpful to keep a more happy or stable state. So all of these things together can factor into a depressive disposition. But what I wanted to talk about is that subjective sense, the more that how do I know I'm depressed? What does it feel like? What are the thoughts? What are some of those things? So in general, I really wanted just to kind of highlight that I think, we can boil depression down to three things. When I'm talking with people, I'm going to ask around these three lines the features or questions about what would be going on in their life. So, for example, the three areas I want to talk about is, one is people that are struggling with depressive features. Often they boil it down to that my life is a mess. There's nothing good in my life. There's nothing worth kind of living, nothing worth looking forward to in my life. My life is like a mess. The other factor that would be hovered around often with people struggling with depression is that I'm a mess. There's nothing good about me. I'm not attractive. I'm not intelligent. I'm not funny. People don't like me. So the lots of this kind of negative beliefs. So often people with depression struggle with negative beliefs about themselves. Another factor, or another kind of general category, would be future orientation. So these people are people that my future has no hope. My future is a mess. So I have nothing to look forward to. I don't see myself being a success in the future. My future looks very negative. So those are just some key three things that I will generally talk to people about. And even yourself sitting there, if you're listening to this video, I would ask yourself, how do you think and view those three areas? How do you view yourself? How do you view your current life? How do you view your future? If it's very negative and there's not a lot of positive there, those are some factors we would want to consider. I think that depression feels depressive too. It feels heavy. People will describe feeling heavy, numb, flat, muted. There's a quality called ahedonia. There's a lack of ability to enjoy pleasurable things. So things I formerly would have enjoyed no longer are enjoyable. So that's another thing. Amotivational. So people are depressed, don't have a lot of energy. They end up staying at home quite a bit, isolating themselves, not getting out, not being busy with their friends. So this will be a common thing. I'll ask people, do you have friends? Yes. Are you getting out to see them? No, but I do talk to them online. That would still count as, even though it's better than not having any friends, that would count as still being fairly isolated, not getting out. So people that are depressed, they feel it in their bodies. It feels different subjectively, feels heavy, numb. There's an apathy. They don't find joy in things, a joylessness, a heaviness, and it feels, they can feel it in their body. So there's something I'll often say. So somebody will be, yeah, I'm doing fine in my life. And meanwhile, their body is telling them something very to the contrary. So I'll say that the mind can lie, but the body cannot. So really trust that body sensation. If you're feeling heavy, numb, apathetic, amotivational, joyless, there's never, barely ever where you're swinging more to the positive side of emotions, happiness, joy, then those are considerable symptoms to pay attention to. Another thing is changes of thinking. In thinking, people who become more depressed become more negative, hopeless. As I said about the future, they don't see a lot of future orientation. They see a lot of negative things in life. There, a common thing would be, yeah, did you hear the news today? And it's only going to get worse. These kind of statements. So they're very oriented on seeing the negative qualities in life. They're in fact attracted to the negative news, and they constantly will be oriented and bringing this up in conversation. Just very negative, self-critical, critical of others. These are features that are also characteristic of somebody that's struggling with changes in thinking. Difficulty concentrating. This is one that I'm will be working towards teasing out with ADHD. So if you have depression, oftentimes it's difficult to diagnose ADHD because it can mask some of those symptoms: poor concentration, poor memory, difficulties making decisions. These kind of things characteristic of ADHD as well. Struggling with organization. Those kind of features can also be part of the thinking difficulties with depression. Forgetfulness, as I said, brain fog. And then there's a lot of thinking of that, I'm not good enough. So any kind of setback very quickly goes to negative thoughts about them. I constantly do this. Oh, this is the same old story it's ever been. I always end up failing. So there's constant orientation around failure. And then why bother? Again, that amotivational, why should I try again? And so giving up easily. These are some of the tendencies towards thinking that is characteristic of depression. So, and as I was saying, there can be changes, physical changes we would notice in the body as far as sensory feeling and numbness, those things. But there's can be also changes in the body like losing weight or gaining too much weight. That could be a change that we would see. Sleeping too much. Also this constant fatigue, not being in, feeling like you're yourself and that something's very different with you. Heaviness, physical, kind of a heavy feeling in your body that doesn't seem to go down, slowing you down. Increased aches and pains. A lot of somatic complaints or body complaints will happen by people who feel depressed, and they'll feel it in their body. And they'll also have a tendency towards, or can have when you're very depressed, towards not taking care of hygiene. We'll see this in children and adolescents. In particular, we'll see this, difficulties with taking care of hygiene, and also a lack of kind of interest in taking care of things like their room, clothes all over the place, never putting posters up or say things that make their room their own. So people who have a healthier self-esteem, feel, more on the positive side of emotions, generally, they'll decorate and be creative with their room. So adolescents that have no interest in, taking care of themselves or their room or their environment or their schooling, these are features that can also be related to depression. And as I said before, changes in behavior, a big one for depression, and then I've, spoken to people about that I've diagnosed depressive features, is withdrawing, pulling away from people, this isolative, insular type living, procrastination, putting things off, avoiding responsibilities, crying readily. So crying and seemingly over little or trivial matters, not that they would feel trivial to the person, but they would be, not as they could handle these smaller things before, but now they seem like they're crying over, littler things. People would also struggle with feelings of worthlessness, not like they're not good enough, excessive guilt, that they're a burden, that they'll feel empty inside, this hollowness. So that emotional feeling of depression is very clear when those symptoms are there. And so also things like that you should notice. Here's some of the differentiation between the levels of depression. When you have major depression, that would be kind of an unrelenting period of 2 weeks where you're feeling down, discouraged, feelings of worthlessness, not good enough, low, depressed, and sad, unremittingly. In other words, there's no break from it over a 2 week period. That would be what we would call major depressive disorder. So the duration is very important. Whereas if you have those kind of naggy self doubts and low periods, but they're more intermittent, you might go through a week where you're doing not too bad, but then have a low period again, and you have that for say a period of 2 years. That's where we would describe more a persistent depressive pattern. The old word we'd use for that is dysthymia, but that would be more a persistent depressive pattern, not as intense or severe as major depression. And by the way, major depression is more functionally impairing. These individuals would struggle with even getting up to go to work or go to school. So if it's about functionality, the level of depression. When you have major depression, it is very difficult to function. And in these cases, you really want to consider medication. Medication is quite a bit about functioning. If you can't get out of bed, can't go to school, can't go to work, then you may want to consult with your physician and chat about a psychopharmacological intervention to help you to reinvigorate your ability to function in your life and re-engage. We don't want to, psychologists, psychiatrists, we don't want to see a person stay in a depressive state, obviously longer than they need to. The brain starts to, acclimate to it, and it becomes more difficult to treat. So very important if you're feeling, more than 2 week period of depression, we don't want to just kind of leave that as it is and just kind of continue that insular, that, poor hygiene, avoiding people, not engaging in pleasurable activities, feeling sad and low, and just keeping away from people. You really want to try to take responsibility and go see your physician or a psychologist, psychiatrist, someone, or even a friend, anyone where you can start to make some movement from being stuck in that depressive state. So those are some of the things that I wanted to talk about with depression. When I'm talking with individuals that are a bit surprised that they are more on that depressive side, I'll talk about re-engagement, taking care of yourself, actually making yourself take care of your hygiene, getting out to work out a bit more often, or whatever hobby you might be involved in, starting to get involved with people, becoming less isolated. These are all, and self-care, good self-care. You would know that better than, lots of people for yourself, what makes you feel better. But thinking about a time in your life where you felt better, where life felt better, whatever qualities or behaviors or interactions you had at that time, try to replicate those, try to bring those back. But a big thing would be also if you get to that level of a depressive state, especially if it's a major depressive disorder where it's just so unremitting, so heavy, so deep in despair, you would want to seek professional care, consult with your physician, certainly reach out to friends, family, psychologists, psychiatrists. These are things I would encourage you to do. For more information, please consult drkellyclarke.com at my website, and I would be happy to help you moving forward through the depression.